Hello and welcome to Traditional Chinese Medicine, Rheumatoid Arthritis. My name is Christina Kapothanasis. I am the Executive Director of the Hawaii Oriental Medicine and Acupuncture Association. I am a licensed acupuncturist here in the state of Hawaii. I am also national certified through the National Certification Commission for Acupuncture and Oriental Medicine. Thank you so much for joining me today. Today I would like to give you a little overview about rheumatoid arthritis. We'll do a quick overview of the symptoms and part of the Western medicine understanding of rheumatoid arthritis, the Chinese medicine understanding of rheumatoid arthritis, and some of the treatment methods and herbs that you can see before us, or acupuncture points that we may choose in the treatment of this disease. The definition of rheumatoid arthritis, it is a special kind of arthritis. It is actually considered an autoimmune disease, which means that the system is attacking its own tissues. It's a chronic disease. It's destructive and inflammatory for the joints. It's usually seen in a symmetric manner. That means that usually both hands or both knees will be affected versus one side of the body, one joint or the other. And over time, the erosion of bone and cartilage can lead to deformities and dysfunction, trouble with range of motion. This is usually due to the synovial fluid. It's the fluid inside of your joints. This is where Western medicine guesses the point of origin is for the cause of the destruction. They're not sure exactly how the disease starts. There are suggestions that it may be an infection that a wide percentage of the population has, and then there are different triggers possibly for it, but they're not quite sure. They do know that the synovial fluid in the joints will become severely inflamed and the cells will have excessive growth. And this growth and this inflammation will lead to the swelling and the lack of range of motion where the joints become stiff, and that erosion will lead to the adjoining tendons and bones and cartilage destruction, which is irreversible. This is the hallmark of the disease, the synovial joint fluid inflammation. People usually feel more pain after periods of inactivity, especially in the morning. They may feel stiffness for an hour or longer, though different kinds of arthritis will also have this experience. So you need to do different tests. They have a rheumatoid arthritis factor blood test that you can take, and different tests to find chemicals in the body that point to this specific condition. Some patients at the beginning may feel very generalized symptoms like fatigue or loss of appetite and loss of weight and just stiff joints in the morning. It takes time before the joints become disfigured and range of motion impairment. Over time, usually in the later stages, you may see rheumatoid nodules, which are large bumps under the skin near the joints, and they may have signs of internal organ vasculitis or different kinds of inflammation with the organs in your body. The heat of this condition can also exacerbate or lead to osteoporosis, and some of the Western medicine drugs can further worsen that condition. Western medical treatment is based on experience. There is no current cure for rheumatoid arthritis, but the goal is to suppress the inflammation in the body, to relieve the pain, and to hopefully prevent further progression of the disease. The choices that they have now are usually associated with risks for long-term use, like the non-steroidal anti-inflammatory drugs that most people take as the over-the-counter pain medication, and that can lead to gastrointestinal ulcers. Over time, the use of glucocorticoids like prednisone, these have extreme side effects, including osteoporosis, insomnia, weight gain, and swelling. They can lead to immunosuppression and long-term elevated blood sugar with the use of these drugs, so it is not ideal. Most doctors do not try to keep patients on steroids if possible, or as low a dose as they can. They have disease-modifying anti-rheumatic drugs now, which are showing to help slow the progression of the disease. Some of these may include methotrexate, but toxicity appears to be in the gastrointestinal system and also in the liver, so these need monitoring. The immunosuppressants don't seem to have better effects, and they have more deleterious side effects, so those aren't an option usually. These treatments will have their most effect within the first 6 months usually, and then after that the disease-modifying anti-rheumatic drugs don't usually have more advantageous effects. So if these drugs aren't working well for you, or if you are unable to tolerate the side effects of them, or if you're just looking for a natural way to help your pain and your condition, then Chinese traditional medicine would be wonderful for you. It works very well for this condition and many others, but especially rheumatoid arthritis. I studied under the head of rheumatoid arthritis at the Longhua Hospital in Shanghai, and it was lovely to see the faces of happy patients coming in. Oh, my pain is diminished, my range of motion is back. They were very thankful. In Chinese medicine, the idea of the pathology behind rheumatoid arthritis is a combination of 3 pathogens. We say that it's wind, dampness, and heat or cold. So if we pick heat or cold, it's usually 3 pathogens, and if it's very chronic or if the joints have already started to become disfigured, then we may add in one more concept that's called stagnation. The wind, heat and cold, and dampness are ideas that are very foreign to the Western mind, but you can think of wind as being a dry condition, where in the desert, when it's too dry, the wind is constantly blowing and picking up, and that will create the dryness and part of the inflammation in the joints. The dampness, you can think of it as a wet, sticky condition, where you can think of the synovial joint fluid accumulating and causing the swelling. It's also combined with the wind to create the inflammation, and the heat or cold. That most people's hands are warm to the touch, but this is not exactly the Chinese medicine heat and cold, yin and yang, that we use to diagnose. We use a more systemic approach with the other symptoms that you may be experiencing. And stagnation is the idea of the erosion of the tendons, cartilage, bones, and joints in general. This long-term, more irreversible damage, we call that stagnation, where something like gets stuck. So this is what we try to undo. We focus on these different pathogens, and we can tell which ones are more or less in each specific patient's condition according to their pulse diagnosis, tongue diagnosis, and their overall symptoms. A lot of people come in with rheumatoid arthritis that also have insomnia. They may have constipation. They may have hot flashes. There are a lot of different symptoms that may coincide, and we can use those to point us in the direction if it's more heat problem, if it's more wind problem, if it's more dampness problem, or if stagnation is prominent. We also have the same treatment goals as Western medicine to relieve the pain in whatever joints there may be, increase the range of motion as much as we possibly can, and take down and reduce the inflammation to prevent further progression of the disease. The main method of treatment we use is herbs, acupuncture, and diet and lifestyle changes. The method that I rely on mostly is the Chinese herbs. They seem to work the best, and I just brought a few today to show you as an example of some of the herbs that we may use for your condition. The idea of meridians in the body, energy lines in the body that flow and the energy or circulation is poor, and that is why you may be experiencing some of the pain. So these first two herbs we have here on the side, the first one is called guizhi, and the second one is dilong. They are very strong at getting into the very small meridians and the collaterals in the peripheral joints, because the joints that are usually affected in rheumatoid arthritis are wrists and hands and knees and ankles and feet or toes. This is where the nerves get smaller, where the blood vessels get smaller. This is also where the meridians or lines of energy taper off and get smaller. So these herbs are excellent for reeling in and helping to open up those channels. In Chinese medicine, if there is stagnation, then there will be pain. 不通则痛. If it's not flowing and open, then there will be pain. So these are excellent for helping to open the channels, and especially the dilong. If the guizhi isn't strong enough, I usually add dilong, which is also helpful for increasing range of motion. The second category that we use is the circulation or clearing the stagnation herbs. These, a lot of them have double duty. So dangui and cuanxiong. Cuanxiong is very strong for circulating the blood, and dangui circulates. It's more mild for circulation. It's stronger for building the blood. These two together also work to build the blood, which helps to take down the wind. Wind is one of the pathogens that we talked about, and in Chinese medicine, classical theory, if you treat the blood and you have plenty of nourishing, moisturizing blood, then you will quell the wind. So these can help double duty in that the cuanxiong can help circulate and further open up the channels. It also has the quality of stopping pain as well as dangui, but dangui can also nourish the blood and moisturize to stop the wind. So we can open channels and build blood. If the patient is more hot, we will usually use, this is lian qiao and hu zang. Some come in whole form that you boil, and some come in powder. I usually try to help people by using the powder. If it's something that you have to boil for a long time, I just try to save people time. Some of them don't come in whole herbs, so that's why you see some of the whole herbs and some of the powder. Lian qiao and jininhua, which is the forsythia flower, those are wonderful for taking out the heat in joints. And hu zang can also clear the heat and take down the inflammation. We call that 清热解毒, clear heat and detoxify. And then it's excellent for controlling the pain. If we come more specifically to the wind herbs, goten, which is a very cute little vine, and sang ji sen, this is twigs and leaves, all parts of the top of the plant we use. These are excellent for taking out the wind, and the sang ji sen can also help build your liver and kidneys, coming back to the idea of if the blood is treated, then the wind will be quelled. Goten is stronger for taking out the wind and pushing down the liver if there's overactive liver. If we look at ye jiao ten, this one is excellent for removing the dampness. Removing the dampness and the wind is also sang ji sen. Ye jiao ten has the added benefit for those patients who come in with insomnia. So if we're having rheumatoid arthritis pain and you're having insomnia, this is the beauty of Chinese medicine. We try to pick the herbs in one formula that can cover all of their symptoms, and we try to get at the root of the problem. If it is a heat wind with more dryness and less dampness causing insomnia or constipation, then we'll try to nourish the yin. We may add maidong, tiandong to these, or shihu to nourish the yin, in addition to adding the ye jiao ten, helping for their joints and the pain and taking out the wind and the dampness. So it's more of an art than a science sometimes. The last two are Lu Jiao Shuang and Ba Ji Tian. These are warmer. Some of the patients are more cold in nature, and we would use the warming as where we might use Lian Qiao and Hu Zang for the warmer patients. Lu Jiao Shuang is building the kidney yang, and the additional function of these two, why we choose these over other kidney yang herbs, is that they can also build the kidney essence, which can turn into liver blood indirectly, building the blood again to quell the wind, and the heat can take care of the dampness. Bajitian has a specific function of helping to clear the wind and damp, so this would be excellent for the joint pain, and they can both build the blood. So sometimes if we have a patient that comes in with more obvious heat, the signs of inflammation are at their peak, we will use the cooling herbs at the beginning until you are feeling less pain and better range of motion, and then we'll work on building the kidneys with a little warmth that will further help you slow the progression of the condition. And we have very personalized formulas, and we change the formula as you change the symptoms to keep on top of the changes and make you feel your absolute best. If somebody came in with heat at the beginning, though these warm herbs may be good for them, we couldn't use them right at the beginning. If you started off with, you have dampness, but you have more wind and dryness, we'll focus on that until we can slowly address the dampness. And there we work through versus Western medicine, which is just one medication to take for long term. For the acupuncture, we also use several different points addressing these same ideas. Today I would like to show you some of the points on your upper arm and hand, so that if you may be suffering from the hand and or wrist pain at home, you can try to use some of the acupressure points to help you right now. Though using your thumbs is probably going to make that a little bit more painful, so I usually suggest that you hold on to a blunt-ended object and use that to stimulate or ask your lovely friends and family to help you. The points that we may use locally for the upper arm would function to, like we discussed with the herbs, open up the flow of energy and the meridians here. There are several different meridians, 3 lines of meridians that run here on the inside of the hand and 3 lines that run on the outside. They go all the way up to the shoulder and throughout the rest of the body. The ones that we use mostly for the arthritis conditions are the large intestine meridian, which runs along here, and it's better for taking out heat and inflammation and increasing range of motion. So if we went over those points, the first one would be Herbal, right here in between your thumb and index finger in the fleshy part of your hand. And if you can squeeze in here or press in here with a massage tool till you get a nice sore sensation. It shouldn't be painful, but it should feel a nice pressure sore. This point is for helping to build your qi, it's helping to take out wind, it's helping to circulate, and it's helping to clear heat. So this is a perfect one, and it's very localized for people suffering from the hand and wrist conditions. A lot of people will also suffer from carpal tunnel because of the erosion of the bones and cartilage here in the wrist, and the inflammation will press on the median nerve. So we try to include the Herbal point for local. We can use the 2 points here on the back of the hand. If you follow up from the first and middle finger through the back of your hand here between the bones, you can use an object to press here, and between your pinky and ring finger, also here, if you can see that, this one and this one in here, those are excellent for opening up the meridians. If you come up a couple inches here, I usually use 3 fingers. It's the easiest to measure from the bend of your wrist, 1, 2, 3, where the 3rd finger lands. This is called Waiguan. This is also wonderful for taking out heat and for opening the meridians and taking out the wind in the body. And when you press, just press in strong enough that you feel a little bit sore. If you press straight in and you don't feel a strong enough sore, then you just press towards one side or the other. When you have between a bone and your finger, between a rock and a hard place, you can usually get a nice sore feeling out of that. If we work our way up from Hogu on the large intestine meridian, we can go to Shou San Li or Qu Chi. Qu Chi is excellent. It's easy to find, and it takes out the heat and the dampness. It's right in the crook of your elbow in this depression, and you can press right in here until you feel sore. You can press these for about 3 to 5 minutes. They're not as strong as the acupuncture points with the needles themselves, but usually I give people a set of points to press in between appointments to carry the effects through to the next appointment. Along here, there are 3 different points, Sanglian, Shou San Li, and Shalian. If you'd like, you can massage all along the top of your forearm here. This is excellent for opening the meridians and taking out heat, and this will help you to regulate the digestive system to take out more dampness. Working our way up, if you come about 2/3 up the outside of the upper arm, you can press right in here. Wherever you feel soreness, you can press. I wore the wrong shirt today. So right here at the end of your deltoid, you can find the depression here. And then if you come down to a little bit above your elbow, this is Shou Li. Any point that's sore, you can follow this meridian up from your hand all the way to your upper arm. Whatever you feel sore points, tender points we call them, or ashishe, you can press those and it will usually help your hands. I know that the idea, what does my shoulder have to do with my hand, but this meridian runs up here, and if we can unclog the whole meridian, then the hands will feel better. For people suffering from carpal tunnel, we usually come here on the inside and close to the elbow, and we find the tender points up through here. So you can massage up in here, and when you feel a point that says, that's sore, then you just press a little bit longer. These muscles here also will connect all the way to the fingers and will inhibit the range of motion. If they're starting to get tight and pull, then we loosen them up and the fingers can open better. So around in here, all of these, I'll find different points with my fingertips to see where the knots are located, and then we'll use the acupuncture needles to go in and help open those knots up. So those are some of the points that you could try on your upper arm to take out the heat and relieve the pain. We would do more points all over the body because we're working systemically on those 3 pathogens, the wind, the cold or the heat, and the dampness. So we may choose points here in the back of your neck to take out dampness in a point called feng shi. We may use points at the bottom of your shoulder blades by the spine called ge su. This point will help to build the blood, clear heat, and take out the wind. It's excellent. It also circulates the blood. We may work on your back here in pi su, the spleen back point. Spleen will be responsible for taking care of some of the dampness. We may work on your kidney point, which is down here. We may work on points around your knees, one called xue hai. It's excellent for cooling the blood and circulating the blood. San yin jiao. I don't know if we can look at the points down on my knee. Is that possible? On my knee over here? Here is a point called xue hai, right here on the top inside of my knee. And this is the cool the blood and circulate. If we come down on the inside of the calf here, about 1 hand width up, you can see San yin jiao. This one is going to help with the circulation. It helps with sleep. It helps take out the dampness. It helps boost the liver and kidneys. This one is an excellent one. And then we may also do some other points to build up the kidneys on the back or on the ankles. We may also use moxibustion, which is a herb that burns like incense. It's made out of the herb aiye, and this herb itself is warming. It helps circulate. We may put this into formulas as well to boil and drink, but they make it into a roll. You light one end on fire, it smokes, and we hold it near the points. This also is excellent for pain relief because of the warmth and the circulation, but we use that more on patients that are cold rather than the heat ones. In addition to the treatments that we do in the clinic, we always recommend our patients to try their best to stay on an anti-inflammatory diet because it makes a world of a difference. Pork is horrible for arthritis of any kind, not just rheumatoid arthritis. It's very inflammatory for the joints. Wheat is another huge aggravator. Dairy products of all kinds, butter, milk, cheese, ice cream, yogurt. Sugar will set off inflammation, and the only way we can maintain the results and further slow the progression is if the patient has as clean of a diet as they possibly can. And for people with high pain, I know that's an excellent motivation to stay on a clean diet because pain relief for people who suffer from pain every day, it can really take a toll on the body. If you are interested in hearing about the diet, you can watch any of the other shows that are on the olelo.org show on the website. And if you have any questions or would like to find a practitioner near you, please give us a call. We would love to help you. There are acupuncturists in almost every city, every state across the country. We hope that you can find relief. And until next time, mahalo for joining us today. Bye-bye.